and welcome to the EBPL podcast, brought to you by the East Brunswick Public Library. We are known as our community's living room, so in this podcast, you will enjoy original, exclusive content, as well as encore presentations from events you have missed. This event was presented as part of our Just for the Health of It initiative. Just for the Health of It is a proprietary health literacy program developed by the East Brunswick Public Library to promote health literacy in Middlesex County. To learn more, visit justforthehealthofit.org. Now, enjoy the program.
Welcome and thank you for joining us this afternoon for today's Lunch and Learn with the Doctor on autoimmune diseases. My name is Kathy Churn and I'm a consumer health librarian at East Brunswick Public Library. Today's program is brought to you by St. Peter's University Hospital and the library's Just for the Health of It initiative to promote community health and wellness. Our speaker today is Dr. Marlene Marte Furment. Dr. Marte Furment graduated from MD Instituto Tecnológico de Santo Domingo in the Dominican Republic. She is currently a third-year internal medicine resident at St. Peter's University Hospital. Please be aware that this talk is being recorded. Participants' microphones are automatically muted and webcams off. When ready, the recording will be available at ebpl.org/YouTube. If you have any questions, please type them into the chat box. Our speaker will answer questions at the end of the talk. The speaker will not be able to offer medical advice to attendees during this program. And without further ado, I'll turn things over to Dr. Marte Furment.
Thank you so much. Good afternoon, everyone. I truly appreciate the opportunity to present autoimmune diseases to all of you. And also I thank my institution, St. Peter's University Hospital, for giving me the opportunity to be here. My name is Marlene Marte, and I'm currently a third-year medical resident applying for rheumatology, and autoimmune diseases is obviously my biggest passion from the internal medicine field. So without further ado, let's just jump into the topic. So before talking about autoimmune diseases, we have to understand how the immune system works, as it's a very complex system in our body because it has one of the most important functions, and it's to protect us from whatever foreign body can attack our system. So the immune system has a complex network of special cells and organs that are going to defend us from those germs and other foreign invaders that might be trying to get inside of our bodies. And we have two types of immunity. One that we are born with, which is the innate immunity, and another one that is called the adaptive immunity that we had to develop with time, that is going to be a little bit more complex as compared to the innate immunity. So when we talk about innate immunity, we're talking about the first line of defense that we have against these germs or whatever foreign body that wants to come inside of the body. So things like skin, mucous membranes, some of the white blood cells that are going to be in the bloodstream are going to be ready to attack in the second that the foreign body enters our system. But the problem with this is that it quickly recognizes and tries to suppress the threat, but it also might attack some good parts of our bodies because they just know how to kill. So for that reason, we need to have a second line of immunity, which is the adaptive one, because this one is going to be a little bit more specific as they first try to identify what is the threat, and they try to develop a targeted response against a threat that is invading our system. So this one is going to take some time to launch, and then it will create antibodies to target the defense against whatever is trying to invade us. So the immune system has different parts. So again, talking about the skin, this one is going to prevent germs from getting into the body. We also have mucous membranes, which are the moist inner linings of some of the organs and body cavities. For example, the mucous members in our nose, they try to prevent viruses to go inside of our body. We also have white blood cells. There are many different types of white blood cells, but in general, they are the ones who were trained to fight the germs and whatever invader that might be threatening our system. And we also have some organs and tissues of the lymph system, like the thymus, the spleen, the tonsils, all the lymph nodes in our body, even the bone marrow. So these organs and tissues are going to produce, store, and carry those white blood cells that we were talking about earlier. Now, when the immune system recognizes an antigen, it's going to attack it. And by antigen, we mean the threat that is, or the germ or the invader that is trying to get into the body. So that is the antigen. And whenever our immune system is trying to attack that antigen, then we call that an immune response. And part of the immune response is to create eventually antibodies to try to attack and kill whatever invader we are fighting against. And these antibodies are proteins that work to attack, to weaken and destroy the antigens. And obviously, not only antibodies, but we also have other cells that help also the antibodies to fight the antigen. But in general, that is what's called an immune response. So if you are like me, I'm a very visual learner. If you have any audio difficulties, just let me know. But I selected this video that I found on YouTube that is very helpful, that's going to help us understand a little bit better what is the immune system. So let me just play it for you. And if you cannot listen to it properly, just let me know, please.
The immune system's first defense is our skin, the largest organ of our body. The skin covers a total area of about 2 square meters, the size of a typical basketball backboard. When microbes attack, they're routinely deflected by the skin. Inside our bodies, mucous membranes are slimy, warm surfaces that make up about 400 square meters, roughly the size of an entire basketball court. They're under constant attack from microbes in the air we breathe and the food we eat. They line our nose, throat, intestines, and reproductive tracts. That's a large area to defend. Your mucous membranes are going to need help. Fortunately, certain cells in your body have evolved to fend off microscopic attackers. Early responders, like this macrophage, identify invaders and attack. They also give off chemical signals, called cytokines, to call up reinforcements like neutrophils and natural killer cells. Macrophages, neutrophils, and natural killer cells, collectively referred to as innate immunity, are nonspecific, often sacrificing healthy tissue to contain an infection. But if the invader slips through, you're going to need a more targeted defense. The adaptive immune system provides a more targeted defense. Dendritic cells are like intelligence specialists. They collect pieces of the invader at the site of the battle. Then they travel to the nearest lymph node, triggering a cascade of events. Inside the lymph node, the dendritic cell presents pieces of the invader to T cells, the immune system's communication specialist. In turn, T cells activate B cells, training them to form antibodies, the molecular weapons that target the invader specifically. The immune system now mounts its ultimate defense. B cells release millions of antibodies, each antibody's shape tailored to identify and neutralize the enemy. The immune system deploys these tailored weapons until the infection is wiped out, ready to respond even faster the next time.
So as you can see, it's a very complex system, but it's fascinating at the same time, because as soon as the antigen comes inside of the body, then there's a front line that is going to start attacking the antigen, but then there's an adaptive immune system that is going to try to target as best as possible the antigen and destroy it in a very effective way by creating antibodies and calling other cells. So that's what our immune system is supposed to do. But then what happens in autoimmune diseases? At the core of the immune system, there is the ability to tell the difference between our own selves and the non-self. So it's supposed to identify what is you and what is different, what is foreign. But then there can be a flaw that can make the body unable to tell the difference. And when this happens, the body makes auto antibodies that are going to attack the normal cells by mistake. So this is when autoimmunity comes in place. Whenever your body is not able to identify that your own cells are the good ones, and then they start attacking them. So at the same time, when we have autoimmunity, there are special cells called regulatory T cells that fail to do their job of keeping the immune system in line. Because remember, yes, we can have cells that are fighting against antigens, but someone has to say, it's good enough, we have to stop, and those are the regulatory T cells. But in the autoimmune diseases, these cells are not able to function properly either. So the inflammation and the autoimmunity keeps going on and on. So the result is a misguided attack on your own body that causes damage, which is called the autoimmune disease. The body part that can be affected by these diseases depends on which type of autoimmune disease you develop. And there are more than 80 until this date described already, known types, and they can affect virtually any part of the body. So some example of autoimmune diseases, we have the alopecia areata, which is an autoimmune disease that is going to target the hair roots. See, for example, this patient here, they're going to present with patches of in the scalp that is not going to have any hair, and that is because there are some autoantibodies are going to be directed in that part of the scalp, so they present with these patches in the head. There's also type 1 diabetes, where our system is going to create antibodies against the pancreas, and we're going to talk about that a little bit later. Another example is very common, the rheumatoid arthritis, where again, the body is going to make autoantibodies that can affect mostly the joints. It can be in the hands, can be in the knees, but they can also, in rheumatoid arthritis, it can even affect the lungs, the eyes. It can basically affect anywhere. So what causes autoimmune diseases? If our immune system is supposed to work against foreign bodies, why our own cells? And we don't have the answer for that. We do know that these type of diseases tend to run in families and that they have some genetic predisposition, but that doesn't mean that is the cause. So genetics is not the real cause of the autoimmune diseases. There's still a lot to research about that to find out why this is really happening. What we do know is that, yes, it does tend to run in families, and that there might be a genetic susceptibility in some family members. And then we also know that some environmental factors such as viruses, smoking, such as even exposure to UV light, many things can also trigger those patients who have the genetic predisposition to have autoimmune diseases to eventually develop the disease. And something that is very important to say here is that autoimmune diseases by any means are not infectious. So if someone has, for example, alopecia areata or has type 1 diabetes, there's just no way that it can be contagious, so you cannot catch them from other people. So which environmental factors have been determined that they might predispose to some autoimmune diseases? We see UV light history, significant amount of exposure of UV light in patients who have dermatomyositis. This is just an autoimmune condition that causes inflammation of the muscles with some skin manifestations, and they usually have this history of some UV light exposure in the past. There's another disease called Guillain-Barré syndrome that can also be related to the environmental exposure to Campylobacter jejuni infection, which is a bacteria that's going to cause diarrhea. So typically, the story with these patients with Guillain-Barré is going to be a patient who had diarrhea, say, for example, 2, even 3 weeks prior to having some numbness, tingling, and weakness in their legs. So that has been determined that that's one of the causes. Other environmental factors such as parvovirus B19, which is another infection common in children, but can also affect adults. When some people are infected with this virus, sometimes they develop anemia, and that is because, again, the body is trying to attack the parvovirus, but then for some reason it confuses our blood cells and then start attacking them and also causes anemia. And smoking has been related to many autoimmune diseases, especially rheumatoid arthritis and lupus. Actually, in patients with rheumatoid arthritis, it's strongly recommended to stop smoking, as this might help prevent further damage of the joints in these patients. Who is at risk for autoimmune diseases? Basically everyone. It can affect young people, it can affect old people at any age, but definitely there is a huge gender gap. Women are is the population mostly affected by these type of diseases. And again, we don't have a straightforward answer as to why women, but definitely there is a big difference. If we see in this chart, we see that, for example, for every male having Hashimoto's thyroiditis here, which is just a condition where the body is going to create antibodies against the thyroid, and I'm going to talk about that later on. We're going to see that for every male that is going to have the disease, 10 women are going to have the disease. So it's a very significant disproportionate prevalence in these populations. So same thing with SLE, with lupus. For every 1 male, 9 women are going to have the disease. And as you can see, most of them are more prevalent in women, especially in the women childbearing age. So young women, those are actually the ones who have the highest risk of developing autoimmune diseases at some point of their lives. So as we were talking about, people who have a family history, most of them, you will see that someone, say for example, you have a patient with Hashimoto's thyroiditis, and again, I'm going to talk about that later on. Most of them are going to have either a remote history of someone, maybe grandma or grandpa had some sort of autoimmune disease, and now maybe grandchildren are having symptoms of autoimmune diseases. So you will find someone most of the time, hopefully, when you get the family history in those patients. Say, for example, lupus and multiple sclerosis are very well known to have some autoimmune diseases in the family running. Also, again, genetics, inheriting certain genes can make it more likely to get an autoimmune disease. But again, we think it's more of a combination between genetic susceptibility from the family history and then being hit by environmental factors such as smoking or whatever, even infections like CMV, Epstein-Barr viruses. So many environmental factors in the genetic predisposed patients can develop the disease. We also know, we already talked about this, about their environment, but we also know that certain ethnic backgrounds are going to present differently. So for example, we know that those patients with type 1 diabetes are most commonly Caucasian. And in the case, for example, of lupus, usually they present in a very severe form in those African-American patients and Hispanic population. So having an ethnic background is sometimes going to make a difference as to how these patients present and how severe is going to be the disease in that population. So what are the symptoms of the autoimmune diseases? So basically anything, because again, remember that the auto antibodies can affect anywhere in the body, so you can have any symptoms. But because we are talking about inflammation from the immune response, we usually, in the case, for example, of joints, we're usually going to have the cardinal signs of inflammation, which are going to be redness, swelling, heat, and pain. And you will also see that in autoimmune diseases, we're going to have that characteristic coming and going kind of presentation of symptoms. So for example, during a flare-up, the symptoms may get severe for a while, but then they can go into remission, which means that the symptoms are going to get better or even disappear completely for a period of time. So it can come and go, and again, it can be any type of symptom. So because every autoimmune disease is completely different, I'm going to talk about some examples of the most common diseases of autoimmunity. So going with the first one is very well known as the type 1 diabetes. In this case, what happens is our body is going to attack the pancreas. And remember, the function of the pancreas is to produce a protein that is called insulin. And insulin is a protein that's going to help the body bring down the sugar, so control basically the sugars. So if your system is attacking the pancreas, then you won't be able to produce insulin. So what happens is they're going to have high blood sugar and you're going to develop diabetes. So in that case, you might have all kinds of symptoms related to high blood sugar. You might have, for example, a lot of thirst, you might lose weight, you might have increased urinary frequency. And that's how usually they present with these symptoms. But again, remember, sometimes diabetes can also be silent, but at the same time, it can hurt your eyes, it can hurt your kidneys, your nerves, even your teeth. So that's kind of like how these patients are going to present. And in this case, you see that we do measure antibodies in the blood to see if that is a type of diabetes mellitus that you have. So we're going to measure what is called the islet cell and the anti-GAD65 antibodies. And if these are positives in the setting of diabetes, then we know it's a type 1 diabetes. So the treatment for this disease is going to be insulin, because that's what your pancreas is not able to produce because it's being attacked by the system. There's another very common autoimmune disease, which is called the Hashimoto's disease. And for us to understand what's Hashimoto's, we have to know that right below our Adam's apple, there's an organ called thyroid, which is the organ that is in charge of producing thyroid hormone. And it's one of the hormones that is going to regulate the metabolism in our bodies. So if our system is attacking the thyroid and then leads to reduced levels of thyroid hormones, then that's called Hashimoto's disease. So Hashimoto's disease is going to produce an underactive thyroid. And in this case, we're going to have symptoms of what we call hypothyroidism, so low thyroid levels in the blood, which can cause symptoms like brain fog. You might also develop some goiter here in your neck. constipation, fatigue, menstrual changes in case of females, dry skin with brittle nails, and they can even present a very severe, they can have even muscle and joint pains. So the antibodies that we measure to diagnose this disease is the anti-TPO. And if this is positive in the setting of low thyroid levels, then we can diagnose Hashimoto's disease and we can start treatment with what we call levothyroxine, which is just a substitute of the natural thyroid hormone. So again, if the body attacks, this is another example, just like the type 1 diabetes. If the body attacks the organ, we just have to supplement whatever is not being produced, and then the disease can be controlled. Also affecting the thyroid, interestingly, there's another disease called Graves' disease. But in this case, the antibodies, instead of destroying the thyroid and not allowing it to produce enough thyroid, in this case, is going to overproduce thyroid. So the antibodies are going to tell the thyroid gland to produce more. So in this case, you're going to have an overactive thyroid. So symptoms that you might present with, bulging eyes. So you're going to have some inflammation of your eyes and they are going to look like as if they were coming out. You can again have goiter. You can have sweating, palpitations. You have this feeling of anxiety, of high metabolism. You can have skin lesions in your legs if it's very severe. Weight loss. Again, you can feel very agitated, anxious, insomnia because you cannot sleep, you're overactive. So in this case, what we're going to measure in the blood for antibodies is going to be the anti-TRAb. And if this is positive in the setting of high thyroid disease, then we can safely diagnose Graves' disease. And the treatment here is to give a medication that is going to reduce the thyroid levels. And we have two options here, so methimazole and PTU. And depending on which medication is better for you, then you will be treated with one of these. Another very, very common disease that it's also caused by autoimmune disorders is a multiple sclerosis. And in this case, the body decides to attack what is the protective coating around the nerves. So it's an autoimmune disease that is going to attack your nervous system. And because your nerves are being attacked, then you can have nervous manifestations such as visual changes. You're going to have mouth and speech problems. You may have spinal cord issues as well, a loss of sensation or numbness and tingling. You can also have a problem with your urinary system and your digestive system as well. So basically everything that is being managed by the nervous system can be affected by multiple sclerosis. So giving a wide array of symptoms such as weakness and trouble with coordination, with balance, with speaking and walking. It can even lead to paralysis if it's very severe and very difficult to manage. It can lead to tremors and again, numbness and tingling, feeling in the arms and the legs, hands and feet. In this case, we don't have a antibody like we had with type 1 diabetes, like we had with Hashimoto's. In this case, it's a more complex diagnosis. We have to perform a tap in the spine to look for some proteins in the fluid from your spine. But definitely, we do have treatment options for this disease, which is going to be depending on the patient, but can be glatiramer acetate, interferon beta, and there are other medications as well for these patients. There are other diseases that go behind the inflammatory bowel disease category, and these are Crohn's disease and ulcerative colitis. So in this case, the immune system is going to attack the lining of our colon, causing what we call colitis, so inflammation of the colon, and they're usually going to present both the ulcerative colitis and the Crohn's disease They're going to present with diarrhea. Some of them are even going to have bloody diarrhea from the amount of inflammation. They can have severe abdominal cramping with rectal bleeding as well. They have weight loss because they lose the ability to absorb nutrients, vitamins, and they basically have this persistent diarrhea that is going to lead to lots of complications. And again, for diagnosis in this case, we don't have a specific antibody that we measure in the blood. This disease is usually managed by the gastroenterologist, who is going to perform what we call a colonoscopy, which is just a test where they introduce a camera to your colon and see if there's any inflammation. They take biopsies, which have to be then to be evaluated for pathology. And if consistent with IBD, then that's how we diagnosed either Crohn's disease or ulcerative colitis. Treatment, it depends a lot on the presentation of the patient, how severe is the disease. But again, what we're trying to do here is to suppress the inflammatory response of the body to the colon. So there are multiple options, but some of them are the aminosalicylates, glucocorticoids like prednisone if they are on a flare. If it's severe enough, we have bigger guns like immunomodulators and even biologics. But this is all going to vary depending on the patient presentation. We also have other autoimmune diseases that can affect the joint. Most commonly is going to be rheumatoid arthritis. Usually they affect the joints, but they basically can affect anywhere. They can affect the vessels, the lungs, the brain, the eyes. So symptoms again are going to be very variable, but usually they're going to have painful joints with swelling and stiffness, especially in the morning. And they can also have symptoms like fatigue, mild fever at home, weight loss. And for these patients, we do have another antibody that we can measure in the blood that is called the anti-CCP. And in those patients that come with joint pains and come with positive anti-CCP, then we can again diagnose rheumatoid arthritis and start treatment. In this case, we have a very effective drug, which is a methotrexate. It's one of those what we call disease-modifying drugs that are going to help decrease the amount of inflammation of the rheumatoid arthritis. So we start methotrexate that can also be accompanied by others like sulfasalazine, leflunomide, and hydroxychloroquine. And we can also do steroids and biologics as well. So the idea behind all of these medications is to try to suppress the immune response against the joints or against whatever system the rheumatoid arthritis is attacking, so that we can try to prevent further degeneration of the disease. And another disease that we see very commonly is the systemic lupus erythematosus, which is more commonly called SLE or lupus. This one is also seen more frequently in female patients, and this one is more systemic in the sense that it's usually it can attack almost every organ, so it's a little bit more difficult to diagnose. So you can have subjective symptoms such as fatigue, such as headaches, sometimes hair loss, sometimes mild ulcers, even mood changes. So it's a little bit more difficult because it can present in a very variable way. Sometimes patients are going to have a butterfly rash that is going to happen in the face. And they can also have joint pains, can be in the hands, in the wrist, in the knees, and even in the shoulders. They can have even chest pain if the lupus is attacking, for example, the lining of the heart, or if it's attacking the lining of the lungs. If those linings are inflamed, then they're going to cause a lot of chest pain. They can also attack the skin in a way that you will become photosensitive. What's basically the definition of when you go and are exposed to the sun, then you might have like an overreaction to the UV light, and you can develop ulcers from being exposed to the sun. They can also have what we call Raynaud's disease, which is just a vessel damage that we commonly see in the fingers where they constrict and then they're relaxed. So they're going to have blue, they're going to turn their fingers from blue to eventually white and then red because they vasoconstrict. They basically, the vessels are going to constrict and become smaller in diameter. So that's going to cause the Raynaud's disease. And of course, they can have weight gain or weight loss. This disease is a little bit more complex to diagnose. It's usually diagnosed by the rheumatologist. In this case, we do have antibodies such as anti-double-stranded DNA and obviously ANA to be tested. And treatment for these patients is going to be hydroxychloroquine. And depending on the severity of the disease, we will have other options such as steroids and biologics. So I know it's a big topic, but I try to give you the key points of everything. But in summary, if anything, you have to know that the immune system was intended to protect us from foreign threats. But the problem in the autoimmune diseases is that for unclear reasons, our bodies attack our own organs, leading to damage. And virtually any organ can be affected. There are more than 80 types of autoimmune diseases. And depending on which system is attacked, then the diagnosis and the treatment is going to be different. And also remember that it does tend to run in family, but that does not mean that everyone is going to inherit the disease. But definitely if mom, for example, has one autoimmune disease, then possibly children may be predisposed to have some sort of autoimmune disease. And I forgot to mention, but if, for example, mom has thyroid disease, that doesn't mean that the children are going to be only predisposed to thyroid disease. They might be predisposed to other types of autoimmune diseases like type 1 diabetes. So that's all I have for you guys. I'm open to questions. This is a talk. So thank you very much for your time.
All right, thank you so much, Dr. Marte Furment. So right now, if anyone has any questions, please type them into the chat box. And just a reminder that the doctor can't provide medical advice to attendees during this program. Tell us about IgA
nephropathy, yes. Yeah. So this type of disease is seen in patients who have, again, they do have predisposition to have nephropathy. That means kidney damage. So basically what happens is that IgA is one of the immunoglobulins that our immune system creates. And the problem with those patients is that those IgAs deposit in one of the membranes of the kidney. So eventually it leads to kidney dysfunction, and these patients end up being in dialysis because the kidneys don't, they cannot function properly. They cannot expel all the toxins by themselves. So that's pretty much of what's IgA nephropathy.
Someone has a question, if you could comment on the relationship between flu shots to neurological diseases.
So with flu shots and neurological diseases, I don't think there is enough data to say that they are relationship with neurological diseases, but there's definitely an association that is very rare with Guillain-Barré syndrome. Again, with Guillain-Barré, what happens is that the body, for example, after it's being exposed to an antigen, such as the Campylobacter jejuni that I was talking about, which is a bacteria, then the body is going to create an antibody. And in case of some shots of some vaccines, yes, the antibodies are directed against the vaccine, but then by mistake also attack the nervous system, creating what we call Guillain-Barré. So there might be an association. I'm not sure about the percentage of flu shots and Guillain-Barré, but there might be a relationship between those. Otherwise, I don't think any flu shot is related to any other neurological disease.
Okay. And then someone wants to know if you could talk a little bit about parathyroidism.
Right. So parathyroidism usually, so for those who don't know, those are very tiny glands that are right below the thyroid gland that I was talking about. And those glands are going to produce a parathyroid hormone that is going to regulate the calcium in the body. In this case, what happens is you can have either high parathyroid hormone or low. In the case of high parathyroid, usually it's because we have either what we call an adenoma. It's just a growth, an overgrowth of the parathyroid glands that's going to produce a lot of this hormone, and it's going to cause high calcium in those patients. So they're going to have symptoms of high calcium. On the other hand, we can have low parathyroid production from those glands, causing low calcium and symptoms related to low calcium. But again, it's not related to autoimmune diseases. It's usually, for example, what we call secondary parathyroidism is usually related to those conditions like kidney disease, where calcium metabolism is dysregulated. Then they can do parathyroid, but it's not related to autoimmune diseases. Do you think a COVID vaccine could have triggered an autoimmune disease? I started feeling symptoms a few months after receiving it, got shingles and started medication. So with COVID vaccine, for us to talk about COVID vaccine, we need data. I don't think we have good data for us to say that they can trigger an immune disease. So at this point, I would say that we still have to do more research about COVID vaccine. It's a pretty new vaccine. So again, it's not about what I think, it's about what data we have around. So we don't have data on that, sorry. Are hives episodes a result of an autoimmune disorder? So hives, not always. It's usually more of an allergic response other than autoimmune disorders, but that doesn't mean that autoimmune disorders cannot cause hives. But again, usually it's not because of an autoimmune disease. It's usually because of allergies. So.
Then there's another question. I heard that type 2 diabetes is now being considered an autoimmune disease instead of a metabolic disorder. How will that affect the treatment options available for it?
Well, with type 2 diabetes, we know for sure that there is no, we don't have an antibody against the pancreas. So right now, if anything, I would say that we have very, very good options for treatments other than insulin. Actually, we are advocating to have as many patients as possible off insulin, because we have very good medications such as SGLT2s and even GLP-1s that are going to be very effective in terms of having decreased cardiovascular risk for these patients, and also they help lower the A1C to the target goal that we're looking for. So I wouldn't say that we are considering type 2 diabetes as an autoimmune disease. It is still a metabolic disorder because the pancreas is capable of producing insulin. But just like I said, there are many good options for those type 2 diabetic patients right now.
And then another question, if you could please speak about psoriatic arthritis.
Yes, psoriatic arthritis is an autoimmune disorder as well, very similar to rheumatoid arthritis. It can affect the joints in the hands, in the knees. But in these patients, they also have what we call psoriasis. These are the skin patches that look like scaly and pinkish. So those patients also can be managed with treatment options like methotrexate. If it's pretty severe, it can also be managed with biologics. So with that disease, we do have very good options for those patients as well. And they present very similar to rheumatoid arthritis. The only difference, not the only difference, but the main difference that they do have the skin lesions that rheumatoid arthritis patients don't, which is a psoriasis.
So that's all the time we have for questions. So I want to thank you again, Dr. Marte Furment, for taking the time to answer all these questions and also for presenting on this topic. And also thank you everyone who attended. And please join us for our next Lunch and Learns with St. Peter's University Hospital. So on Thursday, November 18th at 2 p.m., we have tobacco cessation, benefits, methods, and how to be smoke-free for good. And on Friday, December 10th at 12 p.m., understanding food allergies. So for more information or to register for these programs, go to ebpl.org/calendar. And thank you everyone for joining us for today's talk, and take care and stay safe. Thank you.
Thank you.
Thank you for joining us for today's episode. You can enjoy our previous episodes by subscribing now using your favorite podcasting app. To learn more about the East Brunswick Public Library, visit our website at www.ebpl.org.